Dr. Andrew Obuku was on his way back home on the 22nd of March, the same day the government closed Ugandan airspace to passenger traffic. Stuck in Addis Ababa, he had started his journey earlier in the US and was headed to Uganda. Today, he is glad to be back home, even if he is still in confinement.
I'm really excited that I'm back in Uganda, and I have a defined period of time, maybe 15 to 17 days, and if I test negative for SARS-CoV-2, I'll be allowed to mix freely with the population. We were briefed by the Ministry of Health officials, and all of us were escorted by security and Ministry of Health officials to selected quarantine facilities.
On Friday, the 15th of May, the Ministry of Foreign Affairs cleared 13 people to return home aboard an Ethiopian Airlines flight. Dr. Obuku says he is still trying to figure out how his name got onto the list.
When the Uganda mission to Ethiopia and Djibouti put out a call requesting all stranded Ugandans to submit their travel documents, I heeded to the call, and so did 52 other Ugandans. However, I'm not privy to the criteria that was used to select the 10 individuals that finally appeared on the list to travel to Entebbe from Addis Ababa.
However, government spokesperson Ofono Opondo had an explanation for how the list was developed.
Some of them are UN staff, but they were traveling back home, not traveling on UN official itinerary. And this lockdown found them in Addis Ababa. So Ben Kavuya chooses to charter a plane to bring his family and was given a clearance. And in the process of him seeking clearance, Ministry of Foreign Affairs knows that this person is coming, and also asked the embassy in Addis Ababa and added another 13 Ugandans.
Although Dr. Obuku is happy and feels lucky to be back home, he worries about the very many Ugandans who are still stranded back in Addis Ababa.
I'm also appealing to government to reconsider their decision not to allow stranded Ugandans from other countries to come back home.
However, during his COVID-19 address last night, President Museveni warned of serious trouble if all the 2 million Ugandan citizens living outside the country are suddenly allowed to return home.
Of course, we can say that the evacuees should pay for the tickets for the special flights. The problem, however, is not just paying for the air travel. The main factor is the health consideration. The fear of the spread of the virus when we do not yet have a vaccine and when we cannot yet handle too large numbers for treatment, the way we have handled the 63 that have recovered. We have a transparent policy of how we are going to rescue those people.